Here is our public health assessment and plan for action for 2016 in Ghana. We are a task force at the Ministry of Health and we have prepared a video on Ghana, a developing country located in the sub-Saharan African region. According to the World Health Organization, the majority of the burden of disease in Ghana consists of communicable diseases, which account for 51% of deaths, non-communicable diseases, which account for 42% of deaths, and injuries, which account for 8% of deaths. For children under the age of 5 in Ghana, the top causes of death include malaria at 20% of deaths, prematurity at 14% of deaths, and acute respiratory infections at 13% of the total deaths. For adults in Ghana, the top causes of death include malaria at 13% of deaths, lower respiratory infections at 9% of deaths, and HIV at 9% of deaths. We as a team believe that there are 3 public health issues that need to be addressed immediately in Ghana. The first issue being infectious diseases. The second public health issue in Ghana is prematurity and maternal mortality. The third and final public health issue is water sanitation. These 3 public health issues are cause for concern due to the number of deaths caused by each annually. The main risk factor in the transmission of HIV seems to be sexual transmission. The HIV virus is found in the blood and semen or vaginal fluid of an infected individual. Precarious sexual behavior increases the risk of being infected, as well as increasing the exposure to the virus. These precarious behaviors, as mentioned in the previous slide, include having a high number of sexual partners, having intercourse without the use of protection, and working in the sex trade industry. The main risk factor of malaria is being bitten by a female Anopheles mosquito carrying the malaria virus. People of any age, race, or sex are susceptible to being infected, resulting in the virus being the highest cause of premature death in Ghana. The leading risk factors of death from malaria include child and maternal malnutrition, lack of water sanitation, poverty, lack of knowledge, and little or no access to healthcare. The risk of being infected heightens if one is outdoors, especially in the rural areas of Ghana. Another public health issue in Ghana is prematurity. Prematurity kills 14% of children under 5 in Ghana today. With prematurity being the main risk factor behind Ghana's high infant mortality rate of 49 per 1,000 live births, it is a cause for concern in terms of the public health of children. Maternal health is a risk factor of prematurity as well as its own public health issue due to the amount of women and children affected each year. With a lack of health services, a maternal mortality rate of 319 per 100,000 live births can occur, as well as health issues such as anemia, which affects 64.9% of pregnant women. Our last public health issue is water sanitation. Due to the lack of clean drinking water, problems such as sickness, weakness, and disease can occur, mainly in the rural areas of Ghana. According to UNICEF, 70% of disease is due to unsanitary or contaminated drinking water, making this a major public health issue to all. Our action plan includes various methods that will help to improve the overall healthcare of Ghana. First, we will prioritize health expenditures, including healthcare, family planning activities, nutrition activities, and emergency aid. Second, we will fund programs which aim to decline and prevent infectious diseases. And third, we will educate the public about general health. The Ministry of Health should increase the expenditures which the government implements on healthcare in Ghana. The health expenditures of Ghana in 2013 was 5.4% of total GDP. We urge that this should be increased to 7% by cutting back on other expenditures. With that extra funding, we will first target the rural areas, because this is where the majority of the burden exists. We will also fund programs which aim to decline and prevent infectious diseases. One specific program is Ghana's AIDS Commission, an organization that is pushing efforts to eradicate AIDS in Ghana by 2022. Our other aim is to prevent the spread of malaria by providing families with indoor residual spray facilities, a sufficient number of safety nets, and making available more mosquito repellents. We cannot stress enough how vital it is for the overall public to be educated about basic hygiene. To educate the public, the Ministry of Health should promote efforts to bring in more health and education professionals such as doctors and teachers. There are not enough people to spread the awareness of these infectious diseases such as HIV, and how simply having safe sex can help reduce the number of cases each year. In conclusion, we encourage the efforts of programs which target the vulnerable population groups of Ghana, as well as the mobilization of medical and educational resources to the public, both helping in putting our action plan of achieving improved overall public health in Ghana into motion.